Good morning, everyone. Thank you for joining us. And first, I'm just going to thank all of our sponsors and vendors who help make the conference available. And thanks to all the attendees who are in the room behind me, as well as all of our virtual attendees for joining us today. We have 4 great panel members before you today who will provide important updates. We're going to start with Regional Transit Coordinating Councils and Transportation Coordinating Assistance Projects. And then we will also have an update on the education and training sessions that will be coming forward this fall and winter. And following that, we'll have updates on volunteer drivers and the challenges that the drivers face, as well as the organizations that they work with. And this includes work being done by the Volunteer Driver Coalition, MnCOTA, and MPTC. And I have had the pleasure of working with all 4 of our panel members, and we'll introduce them now. Tom Gottfried, the Executive Director for the Minnesota Council on Transportation Access and Program Director for Mobility Management with the MnDOT Office of Transit and Active Transportation, as we lovingly call OTAT. Tom has over 40 years of transportation and transit experience, from operations to management, and I've worked with him a few of those decades. Tom is a Metro State University graduate in business administration, and he has a master's in business management from St. Thomas University. Tom's 30 years of experience with OTAT range from grant specialist, program administrator, to supervisor to manager, and now his current role is executive director of MnCOTA. And I will add that it's been a pleasure having somebody dedicated as executive director of MnCOTA, who has some time, who has a lot of time to dedicate to working with all of the partners. Next is Karen Onen. Karen is the Senior Community Development Planner at the East Central Regional Development Commission in Mora. She focuses on East Central Regional Transportation Coordinating Council, where her position is that of director. Currently, there are 9 other RTCCs in place around the state, all dedicated to improving transportation access, options, and coordination, with an emphasis on those who are transportation disadvantaged. All of the RTCs throughout Minnesota are working together, ultimately to build a unified system of varied transportation options that is easily navigatable for use by the state's population in rural and urban areas. The East Central RTCC is funded by MnDOT and the FTA, and for the 2020-2021, a local match from 5 counties, including Kennebec, Mille Lacs, Isanti, Chisago, and Pine, was initiated. The next 2 panel members will be talking about volunteer drivers. Dawn Simonson. Dawn is Executive Director of the Metropolitan Area Agency on Aging, and Dawn has more than 25 years experience in the field of aging, healthcare, and advocacy. Dawn is recognized for her leadership as an innovator and as a collaborator. Her priorities are to develop networks and other partnerships that support older adults to live healthy and secure lives at home. I'd also like to add that Dawn has been a great choice for the coalition leader, and give a thank you to her staff, David and Julie, who have been very helpful in providing support to our coalition mission. Tiffany Collins is the Transit Director for Central Community Transit, serving Candy, Ojai, Renville, and Meeker counties. She has been with Transit for 21 years and helped to implement the services for public transit and volunteer driver programs during that time. She has seen many challenges and changes over the years in volunteer programs. Tiffany has been a member of the Minnesota Council on Transportation Access and the Minnesota Public Transit Association board, working on issues for very many years now. We're going to break this up in 2 pieces to make it a little bit easier, and we'll take questions after the first 2 panel members. So feel free to start typing in questions into the Q&A box at any time during the speakers' presentations. And We will go ahead now. I will turn it over to Tom, and then Tom will hand it off to Karen, and then I'll check for questions, and then we'll move to the second half of the panel. Thank you. Tom?
Thank you. Can I have the share of the screen now? Okay, thank you. There we go. Can everyone see this? Good. I'm actually going to be talking about the Minnesota Council on Transportation Access, which I am the executive director on. It was formed in 2010 under Minnesota Statutes 174.285. It's a 13 agency member, 13 members, and it has been in place, as I said, for 10 years. It was in January that I was selected to be the first executive director for MPTC, and since that time we've initiated various different activities associated with that. One, of course, is a work team that specializes on the volunteer driver program and issues and concerns with that, which Tiffany is one of the members from MPTC attached to that work team. It's through the work teams that MPTC actually generates a lot of its work and efforts and focus on and paying attention, and in collaboration with them have been working with also MPTA as well as the coalition. And one of the big activities that MPTC sponsored and helped and was part of in partnership with is the legislation that was being asked and being requested, both in the 2019 session as well as the 2020 session, and now being proposed for the 21 session, is, and specifically the language of how we define a volunteer driver. And I'll let Sherry talk about that a little bit more in detail. But what is unique and a little bit different than what was done historically with this, as opposed to it being strictly a legislative and an activity associated with advocacy, specifically MPTA as an advocate, and also the coalition of on volunteer driver services. The coalition has been very instrumental in putting some interest and energy behind that. And on our July 24th meeting with MPTC with leadership, that means the county, the commissioners of each department was there, hosted by Margaret Kelleher, our commissioner, and basically heard the proposal for legislation to be taken forward and presented to the governor's office for consideration by each of the state agencies that are affected by that legislation. At that meeting, it was unanimously approved to move forward on by all the state agencies, a member of MPTC, and then turned around and moved that forward into our process. There is a process that each state agency has to go through to get things approved. What I can announce to you today is that has been approved for the governor's consideration for his packet for the next legislative period. It is the final stage of where it's going through. Our commissioner will have a sign off a little bit later this, I think next week. And to that end, that's the final piece that goes to the governor's office. So that's good news. It's a long effort, and it is a process that actually is encouraged to go through MPTC, because MPTC, if you go to Minnesota Statutes 174.285, you will see one of the charges of MPTC is to move forward legislation that will address the issues of transportation and transportation access. And in this case, specifically, the issues associated with volunteers and the confusion that used to be, and hopefully will stop being, about what is a volunteer and what a volunteer is not. And specifically addressed the question is a volunteer driver is a volunteer and not a person for hire, which is a term of art at the state level, which is very important to make sure that that's clean and understood. The legislation being proposed will address that, and that is what is being offered and being supported by the governor's office as of this next session for 2020. So congratulations to the coalition members, MPTA, and a little pat on the back on the MPTC for taking this up and moving this forward. So that is a direct relationship of where we're at with volunteer driver programs. More specifically, I'm going to give you an update of how the RTCCs were also a part of that effort as well. RTCCs are recognized and been developed by OTAT through our 5310 program as a mobility manager to deal with various different transportation needs and issues associated with a given geographical area. Karen's a great representative of the East Central RTCC, as well as we have 8 others that are queuing up or have queued up and already in position. We're hoping that we might have 2 more by the end of this year. We'll see. There's an application deadline on November 2nd for those additional 2. We'll see how that progresses, and we feel fairly confident that we may have another 1 or 2 in position for that time frame for January 1 or shortly thereafter, January, the first quarter of 2021. To the effect of, and I will scroll down here a little bit further, is the overall arching goal of MCOTA is to be looking at and identifying and reducing transportation gaps. It's all transportation. It's associated with things that go beyond what public transportation may traditionally have been doing or have not been doing in the past, because it's beyond the reach of public transportation. Usually what we're talking about is a unique design or one-on-one transportation that occurs in that. And then, of course, streamlining the access to transportation. We want to provide effective transportation service, but once we provide effective transportation service, we need to do it effectively and efficiently. And then provide more transportation options. We do have areas of the state, even though we have one of the most robust rural transit systems in the country, we are still have very significant gaps in that service across the state. And to that end, that was a problem prior to COVID, and it didn't get any better with COVID, and it was COVID to move forward on that. As the commissioner had mentioned earlier, there was a COVID-19, and she's right, it's a mouthful, COVID-19 positive clientele transportation. That's how we had to package it for the feds and for M&B for the application we put together for $750,000 that will carry us through the end of the year, providing basically knowing that we're transporting people with COVID or very strongly suspected of having COVID, but transporting them in a way that is actually safe and reliable and does exist. Some of the public transit systems have stepped into that space and are hiring that out to some of our STS providers and partners, but not across the state, not because the public does not need to do this or have to do this. Some of them did because they were able to in their capacity to do so. But it was very uneven, and so MnDOT was asked by various different programs and advocacy to make sure that this happened, specifically out of the Olmsted office. We were asked to try to create equity for all people with disabilities for transportation, because again, accessible transportation for people who have COVID and still need medical treatments was very important. So that's a shout out that's being put on the street right now. I can declare at this point in time, we have an executed agreement with SEMCAC in southeastern Minnesota, who will be providing that transportation coordination of that and working with all the vendors that we anticipate to be needed across the state to actually provide that service. So that's a shout out for that piece. But back to the regional transportation coordinating councils, it's because we have regional transportation coordinating councils that some of this stuff and some of this issue, matter of fact, specifically the issue of the gap of services for people that were COVID-19 actually came through the regional transportation coordinating councils as identifying this as a gap of service and need that needs to be taken care of. And many other aspects of that has been put into place because of the RTCC's existence and out there, and working in collaboration and working with the public transit systems. So there's a very symbiotic relationship in between what the RTCCs do and specifically what the public transit systems are doing. And that ties us right back into the volunteer driver program as being a key thing, because we know most volunteer driver programs were highly affected with COVID-19. And Tiffany can talk about that much more articulately than I can, so I'll let her carry on that discussion. Essentially, there's a representation of the RTCCs that is well highlighted. The county departments of human services, as it seems to be obvious, aging is attached there, hence Don has been attached to the discussion. But there's more to RTCCs. We also have the TCAP projects in the metropolitan area. So we have a total of 6 metropolitan area transportation. They tend to be more county level, except Carver and Scott is a combined TCAP project that actually provides a whole variety of human service transportation. But it also includes veteran services, independent living, just a whole gamut of diverse opportunities. I'm going to go to a slide right here that kind of shows more specifically where we are in the transition for that. We right now had 4 systems that were in the planning stage: Mankato, Prairie 5, which is in Lackaporro County in that area, southeastern Minnesota, which is the Rochester area, and then the St. Cloud area, RTCC. Both the Southeast and St. Cloud planning has been completed and is done and is waiting for an opportunity to move into phase 2, which is the implementation stage. Recently, Southwest completed their planning phase and just recently, as of July 1, moved into the Southwest, or moved into phase 2, which is the implementation stage of the RTCC. And there's 3 stages. Stage 1 is primarily all planning. Stage 2 is really taking that plan and putting it on the street, hiring the staff, getting everything set up. And then phase 3, which is the biggest stack you're seeing right there, are the ones that are now in the full scale of implementation and are will be entering into their next year. We'll stop calling them phases at that point and moving forward. The metropolitan area has 2 systems that are in phase 1 planning, Anoka County and Hennepin County. And then also we have 4 of them that are already in what we call full-scale implementation. TCAPs have actually been around longer, specifically the 4 that you see here, around longer than the RTCC, and it's actually from those development of those programs about 3, 4, 5 years ago that we actually started seeing we need to start implementing this out in Greater Minnesota. So OTET position resources to be able to do that with the 5310 funding that we have available to us. And what type of things have been going on in those, specifically with the TCAPs and very specifically with the RTCCs of lately as they mature into their projects, is a whole host of things. I've just given just a small sample of the type of thing. They've also been involved in the COVID food delivery programs as well. They've also been dealing with getting a full inventory. This is probably one of the biggest tasks that they've done, of looking at the inventories that are available of all the providers. That's churches, private nonprofits, private for-profits, all the individuals, entities, organizations that are out there providing some level of transportation, either for specifically only their clientele or potentially for other clientele as well, which then gives us the opportunity to be looking at some coordination and collaboration or outright partnership for them to move into providing services at a different level throughout the region that the RTCC is going to be working with. That is one of the biggest issues that they've been working with, is trying to develop those partnerships, and that's the process they have to go through. If anybody can remember when a public transportation started in their first 2-3 years, that's essentially where an RTCC is at this point in time. They're in that very early stages of being out there and developing those partnerships and relationships in an effective way. This gives you a complete list of those, and right now I do have somebody other than myself working on this program. As her name is Michelle Littig. I believe she's part of the audience today. She'll probably be asking all the really hard questions for me. But anyway, if you have any questions, I'd be happy to entertain them right now. I just went over this fairly quickly just to kind of give you an idea. Happy to entertain any questions.
We'll go to Karen first, and then we'll take questions.
Well, that happened quickly. Thank you, Tom. I'm Karen Onen. I'm with the East Central Regional Transportation Coordinating Council, and basically the 5 counties of Pine, Isanti, Chisago, Mille Lacs, and Kanabec. I got all those. I'd like to share my screen if I could. Let's see here. Got it right here. We'll see if it works. And I hope you see pumpkins. Awesome, thank you. I don't hear anybody. All right, I'm going to start this from the beginning. I am going to talk today a bit about the new, the Volunteer Driver Forum, which is coming up it's a series of forums rather than one day, one conference as it was in the past. And I'm just going to go through the slides, so I'm going to try not to deviate too much. It started out when we started talking about this new forum. It started out when we were getting together with a group of people. Tom got in touch with all of the RTCCs, and I rose my hand, and I was very interested in getting involved in this. But other than the RTCCs, of course, we had members of the MCODA, MIPTA, the Volunteer Driver Coalition, CTS, MnDOT, DEED, the Central Minnesota Council on Aging, M3A, Minnesota Area Agency on Aging. There were private stakeholders and regional transportation coordinating councils, as I mentioned, and then the Minnesota Association of Area Agencies on Aging. So there was a good group of people who got together to kind of pull this together. It was started, and Tom, stop me if I'm wrong here, but I believe we got this started last fall. And the virtual nature of this whole thing really solidified when COVID hit. We knew we had a lot of topics to cover, and we knew we couldn't get everybody to sit down and watch something for 6 hours straight. So we decided to split it up into a forum series and do it month to month. So what we're planning on doing is we have between an hour a month and 4 hours a month, but they're split up. So you'll see as we go through here. The 2018 Volunteer Driver Forum had a survey done afterwards, and the survey had a lot of answers, of course, but 2 of them that stood out were, one was to have questions, people able to ask questions, and a lot of folks didn't feel like their questions were answered, especially if those questions came up afterwards. How do they reach out? And the other one was having materials available ahead of time. Well, all of that now will be taken care of with this forum. We're asking people to ask questions beforehand, and our very first forum will be what we are going to be doing moving forward. So they'll know who's coming, they'll know what to expect, and they will be able to ask their questions so that the presenters then will be prepared to answer when they come on for their forum. Okay, so the first stop we've been calling it, these are different stops along the road, is the current state and a look into the future of volunteer drivers. That will happen on November 18th from 9 until 10. It's a very short one because I understand there's another conference that's going to take place that day where we want people to be able to attend, and so we don't want to take up their space. So this one will be only an hour long. The purpose of that first forum is to address the state of volunteer drivers in Minnesota and the vision and goals of the series. All participants are encouraged to take the opportunity to ask questions and provide comments to the upcoming forum speakers in order to assist in giving direction to their content. Okay, that's the first one. The second forum is going to be on December 9th. These are all on Wednesdays, and that one will be 2 hours. And this one is going to talk, to begin with, about real world stories through the voices of volunteer drivers. We will have videos of actual drivers and riders, people who use volunteer driver services. We wanted to do that because we wanted it to hit home. And then after that, we will talk about the discussion of state and federal issues regarding volunteer drivers and have perspectives from the Minnesota Board on Aging on volunteer driver services. And then there will be a mission and overview of the Volunteer Driver Coalition. That one's good. I mean, these are really great. Okay, the third one will be in January 20th from 9:30 to 10:30. And this one will be about the volunteer driver recruitment and promotion. Martin Lepak, who works with the Arrowhead region, which is a northeast region of Minnesota. He works with their volunteer driver program, and he's their recruiter. And he is just fantastic, and he will be a great presenter. He's very dynamic, and he can get people to volunteer. He goes to different places such as auctions and meets up with the guys at the auction out there and talks with them and recruits them to volunteer drive. And you'll get to know him a little bit when you come to that forum. The next one is how to start a volunteer driver program. And Jenny Rowland, who works with the Boise Fort Band of Chippewa, who handles the local bus service there called Big Woods Transit, she developed this rural volunteer driver program in the Arrowhead area. And she will talk about scheduling software options, driver testing outlets, and funding sources, among other things. So then, into March, we are going to do 2 series. One is in the morning, one is in the afternoon, so you get a nice little break in between there. And the first one will be on person-centered training, where the person is the primary focus rather than a disability. And then the second one in the afternoon will be cultural diversity and equity training, which is especially pertinent as the world is evolving today. So that one is on March 17th. I don't know if that's St. Patrick's Day, not sure. Then the 6th stop is in April, and the first one, again, is a double one. They are both sensitivity issues, and they are dealing with the person as they are, not focusing on their past trauma, and we're learning sensitivity. I think that's something that's really going to hit home and be really interesting for many people. Hopefully we'll get a lot of folks. And then the last one that we have at this point, and you never know, we may want to add more as we go along. If people are interested, we can do that, are the best practices for volunteer driver programs. And basically we're talking about safety, security, crisis, medical issues, passenger issues, resiliency and boundary issues, things that may come up as a driver is taking people places and how to handle things. And Easter Seals is helping us with that. I'm sure this is going to be a great program. We are not positive it's going to be 2 parts yet. We have a little bit of time because it isn't until May, but this is the plan of the topic, so you get the gist. So all the forums will be at no cost. Registration, though, is required. All the forums will have closed captioning and ASL interpretation available and will be recorded, and the recordings will have closed captioning and ASL interpretation as well. Other reasonable accommodations will be available upon request, and we're just trying to make this as available to anybody who would like to participate. You sign up for all of them, but you will get a number, and when you come on, you will then put, you will be individual. It's not a number that you share, but you don't have to come to all of them, but we would like you to, but you can pick and choose what it is that you want to be participating with. So the next screen I have here is, I hope you can see it, but it's got a few links on here that I think you would be interested in. CoordinateMinnesotaTransit.org will take you to the next one. And if you want to remember the next one, be my guest. It's a little longer, but you want to look for the Volunteer Driver Forum /2020-21. And then the other link that's on there is for the Volunteer Driver Coalition site. And I highly recommend that everybody take a look at that. And if you're not already a member of the Volunteer Driver Coalition, and I'm just plugging in this, I would like you to consider being a member of the Volunteer Driver Coalition. All right, well, I just wanted to thank you. And I also want to just quickly thank a few people. I'm just going to throw this out there. I've never been on a stage to be able to do this before, but I'm going to say thank you to Beverly and Tom, Michelle and Katie, Arlene and Dawn, Mary, Sherry, Ben, Kim, John, Jody, and to all of you for listening, all of you participating, and help us spread the word. So, let's see here. That's the end of mine. And I was going to introduce Dawn, but if we're going to take a break, do we want to wait? Or Sherry, give me a little heads up here.
All
and
right.
if anybody has any questions.
Thank you very much, Karen. Thank you very much, Tom. And we will stop here and take any questions that members have been submitting either online or from those of you in the audience. And then we will move forward to the second half of the panel. There will be a Q&A session after the second half of the panel. So if you have some questions for Tom or Karen later, you'll have a chance to catch up. So right now I'm just going to check with our technician here and see if we have questions. Yes, the first question is whether the PowerPoints will be available, and they will be posted online at MPTA to be shared with you. Okay, Tom, a question for you. Tell the audience why RTCs are relevant during the time of COVID.
Where RTCs step into the fray and augment what currently are happening with the public transit systems, it gives them an opportunity to look at that partnership list of all the providers that are out there and also start looking at the different opportunities that are available for answering the question of how do we move people from point A to point B, or are we looking at doing some other thing, like a lot of the public stepped into the space of delivering food deliveries and food stuff from food shelves. Some of the RTCCs and specifically a lot of the TCAP projects in the metro area actually stepped into that space very big. And even though the publics were doing a fair amount of transportation, as was mentioned earlier, as Charlie was making his presentation of what was happening in the metro area, and Margaret made reference to the public transits in greater Minnesota, the RTCCs and TCAPs were also engaged in that discussion about looking at different types of partners of how we can glue this together. And we saw some very creative, be honest with, things I hadn't thought of, all those 40 years of experience. It's amazing the energy and synergy that has been created by both the TCAPs and RTCCs to come up with some very creative solutions for addressing access in very new ways that COVID has challenged us and made us look at things differently, and will continue to do so. And hence why these partnerships are really healthy, both for the publics as well as the RTCCs and the members of each of those councils as we move forward.
Thank you. The next question is for you, Karen. And the question is, who should be attending the Volunteer Driver Forum series?
Well, this series is aimed at anybody who's obviously interested in volunteer drivers, but that would be drivers and riders, but also funders of volunteer driver programs, those who are private entities, organizations, nonprofits, CAP agencies, public transportation services. I thought I would be able to name them all off. Tom, do you have any others that you can think of that I'm not mentioning?
I think he covered pretty much of those various different entities doing that. I think we also just want people to know that the first three, well, the first one actually is a kickoff for the whole series to kind of more or less let everybody know how to access. But the one in December is getting into really more of a policy discussion. We'll have a policy discussion a little bit at the first one, but gets in that. So that's where you probably want your county commissioners and your legislators to be definitely paying attention to that. And the second in the series as well in January would be the same. I think, I'm being blank here, I think Sherry's actually going to be presenting at one or the other. I can't remember which one. But,
December.
Thank you. Thank you. So Sherry's going to be there. Obviously, we're going to be talking about policy. It doesn't mean that we wouldn't want other people to be there, but those two specifically are the ones where you want the policy makers to be sitting in the meeting and hearing about what's going on with the volunteers and the current status of where we're at. That said, the other ones going later in that gets a little bit more into the weeds about the how to, when to, where to, and how to maintain. And we all know that we're challenged right now at recruiting volunteers, but also keeping volunteers and under any circumstances. And then we enter into the COVID-19. So that's going to be more specific to the mechanics of the of how to do volunteer driver services. So just thought I'd add that and that kind of focus.
Thank you. And then we have one more online question, and for Karen and Tom, whichever one of you want to take this, and that's, will the sessions, recording of the sessions be available for viewing afterwards? And I'll add to that, will they be ADA accessible?
Yes, absolutely. And it was a point I really wanted to send out to everybody that yes, they will all be recorded. It will be on the site that was brought up, the screen that I had up earlier. And now I've drawn a blank as to what it is. I have such a mess going on here, I can't find it. But yeah, we'll be all recorded and they will all be ADA accessible. Yes.
And as I made a point earlier, Mark, is the latter ones will probably be more focused to the drivers and the operators of volunteer, and all this will be available in recordings, and people can view them at later dates. We encourage them to be at the live event if they can be, partly because they can ask some questions specifically. Also, as Karen pointed out earlier, we're actually, because you'll know what the topics are going to be prior to the event, before the forum occurs, you'll have an opportunity to have anyone ask any kind of question in advance. And what we'll do is we'll make sure that the speaker or the presenters are addressing those specific questions.
All right, that's the end of our questions. And so now I'm pleased to turn it over to Dawn and to Tiffany, who will talk about volunteer drivers. And Dawn is going to focus on the coalition, and Tiffany is going to be talking about her work both with the MPTC board and on Minn Kota to bring Minn Kota to a very activist place compared to where they'd been in the past. So Dawn, please go ahead.
Thanks, Sherry. And I will just go ahead and share my screen here. Moving for you. All right. If for some reason you're not seeing my slides, please let me know. So wonderful to be here with you today. I have been.
Dawn, we don't see your screen. Sorry.
Do not see my screen. All right. Okay. Let's try this. All right. Do you see my screen now?
No.
No? All right. Let's try this one. How's that looking?
No.
No? All right, let's try it. Now that you see it now.
Yes, thank you.
Super. Okay. So let me just make certain. Still see my screen? All right, I see lots of shaking heads. Thanks for that. I've got two monitors and sometimes that causes a little problem. So thank you again for including the Volunteer Driver Coalition in your conference today. I've been in the field of aging for many years, and my first job in aging was at the Arrowhead Regional Development Commission. And I am guessing there are attendees from Arrowhead Transit here. So senior transportation, all transportation has been an important issue for me, and one that I have paid attention to for many years, but it feels like the work we're doing today with the Volunteer Driver Coalition is going to make a significant difference, particularly for volunteer driver services. So I co-chair the Volunteer Driver Coalition, but this is a shared leadership model. Sherry Munyon, MPTC, Lori Vrolson, the chair of the Minnesota Area Agencies on Aging and the executive director at the Central Minnesota Council on Aging, and Mary Quirk, the executive director of the Living at Home Network. We are all co-chairs of the coalition, and we've all been a part of forming the coalition, helping it determine its goals and making certain that we are acting on those goals. So you might ask, why are area agencies on aging interested in volunteer driver programs? And just a couple of context setting topics here. One is that we are funders of transportation programs, including funding volunteer driver programs through the Federal Older Americans Act. And we also take many calls, as some of you know, area agencies on aging are partners with the Minnesota Board on Aging, and we provide senior linkage line services. And while Medicare calls about Medicare are the most frequent types of calls that come into the senior linkage line, calls about transportation, people looking for transportation options, trying to figure out how they pay for transportation, if they qualify for special transportation, are very common calls to the senior linkage line. And for example, here in the Metro, we answer calls on an annual basis from about 45,000 people. Thousands of those calls come from seniors or their family caregivers looking for transportation options. And volunteer driver programs are critical to being able to provide them with access to services. And then finally, area agencies on aging are advocates for older adults and family caregivers. We're charged under the Federal Older Americans Act to be advocates on behalf of and with older adults. All right, so let's look at our slides. So likely, speaking to the choir here, we know that volunteer driver programs are a critical part of the transportation infrastructure in the Metro, but perhaps more significantly in rural Minnesota. And we know that over 77,000 Minnesotans count on volunteer provided rides every year. And those rides are most essential to help people have access to the community, right? Transportation is an access service. And without transportation, people cannot get access to services that help keep them well. And, when you think about, obviously, access to medical care, those appointments that occur on an ongoing basis for treatment of conditions such as kidney failure, diabetes, cancer are so necessary to sustain life, and volunteer drivers play a big role in making certain that older adults and people with disabilities and others can get the ongoing medical care as well as the acute care that they need. And as you know, people also need access to their communities. They need to be able to go to the bank, they need to get government services, they need to shop at stores. Now, something from an aging lens that we often think about related to the need for transportation is that I think we all have to recognize that we will spend, if we're lucky and fortunate enough to live long lives into our 80s and 90s and increasingly becoming triple digits, 100 or more, we will spend on average, about a decade not being able to drive. This is particularly true for older women who tend to live a little longer than older men. But we all need to plan for those years when we're not able to drive. And it could be a physical disability, it could be a cognitive issue, it could be that we can't afford a vehicle. So volunteer driver programs are often the answer in many communities in our state. And we know that volunteer drivers provide safe rides. They often form a relationship with the rider that they're providing rides to over time. They help to reduce isolation of people who are often confined to their homes more than others. And volunteer drivers are trained, right? They're vetted, they have background checks, they're trained. They can often assist riders door through door, right? It's more than a ride. So I'll talk first about when and how the Volunteer Driver Coalition formed, and then we'll move on to the issues that we've rallied around. So the coalition formed late in 2019, and it was just such a clear again, example of how important relationships are in this world. Relationships matter. So it was Mary Quirk of the Living at Home Network who connected me to Sherry Munyon, your legislative policy leader for MPTA. And Mary was the linchpin. She knew that MPTA had been focused for some time on bringing legislation forward to address issues that affect and impact volunteer drivers. And Mary also knew that the area agencies on aging had included support for volunteer driver programs in our legislative platform and knew of the Metro AAA's concerns and work on volunteer driver programs, and work we've been doing for a number of years, but not very well connected to stakeholders. So thanks to Mary at the Living at Home Network, we were connected, and then we quickly brought in Lori Vrolson, the chair of the Minnesota AAA Association. And we all then identified other organizations that were interested in the viability of volunteer drivers. Programs had concerns about the viability, had shared concerns, and we started just to put some very informal invitations out about connecting via meetings. At the time, they were both in person and with virtual. They were kind of hybrid meetings to see if there was enough, as Tom said, energy to form a coalition to really bring what was needed to raise these issues of volunteer driver programs and their sustainability and their importance to a level, to a scale that would interest legislators to the degree that we needed to interest them in order to create policy change. And so when we think about the Volunteer Driver Coalition, it's these four organizations that brought it together: MPTA, the Living at Home Network, the Metropolitan AAA, and then the Association of AAAs. And we continue to share that leadership model. I think what was so amazing to me, and I think to the co-chairs and others who've been part of the coalition, is how quickly organizations around the state were interested in being part of the coalition and committing to support our legislative advocacy and to using their names in our materials and on our website. And right now, the coalition members stand at more than 80 strong, and you'll see it's a variety of organizations across Minnesota. It's a very deep membership, rural, metro, suburban, and made up of nonprofit providers of volunteer driver programs and ride programs, and transit programs, government organizations delivering ride services, and then we have very significant participation by membership associations. So the Minnesota Township Association, they've been leaders in this area for some time, the Association of Minnesota Counties, Council of Nonprofits, the Minnesota Leadership Council on Aging, and then some of our most effective advocacy organizations, AARP Minnesota being one. The coalition functions, as I said, not terribly formally, and meetings are virtual right now. Generally once a month, we schedule those meetings depending on when they will be most fruitful in terms of reaching our goals. And really anyone is welcome to participate in the meetings, whether they choose to join, their organization chooses to join the coalition or not. So an example of that would be Minn Kota. Tom has been participating in coalition meetings and bringing news of Minn Kota to the coalition meetings, but Minn Kota hasn't formally joined as a member of the coalition. Sometimes organizations or bodies, entities can't join, but when they can, we are very welcoming, and you'll see providers that you recognize, maybe some of your organizations and organizations that you might belong to. So as we began to form, we recognized that in order to be effective as advocates and to indeed change policy and have credibility at the legislature, that we needed to have some solid data as well as to have stories to tell about the critical nature of volunteer driver programs. And so we did do a survey. 63 organizations responded. The data that we gathered are data from 2018. And basically what we learned of the 63 organizations that responded is that 60 of these programs serve older adults, 24 serve people with disabilities, and 16 serve youth. And of course, some programs serve multiple populations. They provided rides to more than 77,000 people in 2018, over 168,000 one-way trips, over 9.5 million miles driven in 2018, and over 500,000 hours contributed. Volunteer drivers contributed so significantly to the well-being of others, their neighbors, and our communities. Now, these data likely do not reflect the entire universe of people served, one-way trips, miles driven, or hours contributed, but they are a snapshot of most, I would say, most of the volunteer driver programs that are active in Minnesota, but it's not every volunteer driver program. If anything, we know that these numbers are bigger. Now, part of the survey also helped us to really get a very clear picture about the threats to volunteer driver programs and the impact that they could have for people, for organizations, and for communities. And, you know, what we heard from volunteer driver programs is that they were losing volunteers because volunteers were experiencing increases in insurance rates, as some insurance companies were classifying them as commercial drivers. We know that volunteer driver programs also, often those volunteers deliver meals as well as donated organs. And we were hearing from respondents that their drivers were no longer willing to deliver meals or provide rides. We also heard, for example, that in some programs, volunteers were needing to drive 7 days a week rather than having any days off. And we know that that can get tiresome pretty soon. We also heard from programs that they were only promoting, for example, some kinds of rides like grocery shopping rides internally and not publicly because of the inability to meet demand. Another program told us, we routinely deny 2 to 4 rides a day because due to lack of volunteer drivers. Overall, 24% of the programs that responded to the survey, the 63 programs, reported negative consequences related to insurance companies trying to classify volunteers as commercial or drivers for hire. So drivers that might be more associated with taxis or Uber rides or Lyft rides. So our survey really then did give us a pretty clear, again, picture and a strong handle on the common issues that are facing volunteer driver programs. So we had both a data story, we had lots of good quotes from organizations that responded, and basically we found that the common issues is that it's becoming more difficult to recruit and retain volunteer drivers. This pressure from insurance companies on some, not all, but some volunteers to pay higher premiums was resulting in fewer people being willing to drive or remaining drivers. We also know that there is an issue related to mileage reimbursement, and many of the volunteer driver programs that we surveyed do provide mileage reimbursement, and it ranges anywhere from 14 cents a mile to the IRS rate, which at the time I believe was 58.5 cents a mile or something similar to that. Some volunteer driver organizations pay no-load miles as well as the miles when the rider is in the car. But that any mileage reimbursement over the federal volunteer established rate of 14 cents per mile is considered income, both under state law and under federal law. And that can become a disincentive, right? It's a financial disincentive to volunteers who then suddenly have to declare part of their volunteer mileage reimbursement as income. And nonprofit organizations and others are required to report this volunteer mileage reimbursement when it's over $600 a year for any individual to the IRS. So the IRS knows that people are receiving mileage reimbursement when it's over $600 a year, and then the volunteer is liable for anything that was reimbursed over 14 cents a mile. And we know it costs a lot more than 14 cents a mile to maintain a vehicle and to drive a vehicle. There's also been, over the years, some concern by nonprofit organizations that, well, we know that there are very few chargeable accidents related to volunteer driving. For example, in 2018, our data tells us that there were only 3 accidents among the thousands of trips that were provided, literally over 160,000 one-way trips provided. There were 3 chargeable accidents in 2018. So volunteer rides are very safe, and we're not aware of lawsuits, but nonprofit organizations often don't have very deep pockets. Many of them, of course, have liability insurance, but there is this risk that there could be financial consequences related to an accident, and a nonprofit organization could be sued, perhaps above and beyond the level of liability insurance that they carry. And so nonprofit organizations are looking to limit that liability in case of an issue. Very unlikely, but any nonprofit leader or board of directors wants to be certain that they are managing risk as a nonprofit organization. So this is another issue that came through pretty clearly. And then, as I said, we believe these issues could be resolved with legislative change, most of it at the state legislature. We would also need some help from Congress on the federal income issue. And MPTA had been leading this work for a period of time, but that really requires a groundswell of organizations and people to create the kind of legislative change that we're seeking. And that organizations, bodies like MPTC would say, yeah, look at the folks behind this in the organizations, more than 80 organizations. We're ready to lend our efforts and our organizations and state agencies and boards to making legislative change a reality. We think that will happen in the 2021 session. Now, the call to action that the Volunteer Driver Coalition put out for 2020 is very much, and I think you've heard some of these potential changes already. Want to be certain that we define a volunteer driver in law as not for hire. We need a definition of a volunteer driver in law. We also, our second priority issue is the third bullet down, which was we worked in 2020 to create a state income tax subtraction so that if volunteers are paid more than 14 cents a mile, they don't have to declare that as income. And we had some good success on that. And again, with leadership from Sherry and MPTA, where that provision is currently sitting in the tax bill, and very small, maybe tiny chance that the tax bill could yet be passed in a special session this year, and we would see that come to fruition. But bipartisan support for that tax subtraction. And then we also will be looking in 2021 to renew our call to action to protect volunteer drivers from increased insurance rates when those rates are increased simply because they're a volunteer driver. And then we want to also help to protect nonprofit organizations, similar to the protections in law around governmental units that provide volunteer driver programs and other services, so that there would be a cap on liability that would stem from any single accident or instance. So that's our call to action. Very similar in 2020. We expect it to go forward this way in 2021. And we are very grateful to MPTC for incorporating and bringing to the governor this need to define a volunteer driver in law and to create an income tax subtraction. in Minnesota state law. Now, we've also been active with the federal delegation, our senators and House members on the federal level, to also ask them to work with their other members of Congress around not only an income tax subtraction, but also saying that 14 cents a mile is just not enough. That rate needs to be equal to the business rate. The IRS sets the business rate every year. Let's just make that the volunteer driver rate. So we've been working on that issue as well, which has to be resolved federally. So I would just end my comments again by thanking the co-chairs of the Volunteer Driver Coalition, and thanking every member of the Volunteer Driver Coalition, and then inviting everybody attending today to spread the word about an opportunity to join the coalition, and asking all of you to consider joining the coalition so that we can add your name to our roster. In return, we will be certain that we're providing you with materials. We're just about to release, I think it's today, an advocacy toolkit, which would give you materials that would include some photos and some ready-to-go social media posts, would give you a Q&A that you could use in town halls when for candidates for state office, so that you're armed with questions to ask potential candidates for office, and also an FAQ about the Volunteer Driver Coalition and about the issues that we are working to change. And so so you would lend us your name and your support, and in return I think you will benefit by being equipped with the kinds of materials and facts and support from others, camaraderie, to really be certain that the changes that we all see as so important to preserve and protect and grow volunteer driver programs happen in the 21 legislative session. So that is that's the end of my comments today.
Thank you very much, Dawn. And now we'll go to Tiffany.
Thank you very much. I'll be very brief today, but just wanted to kind of tag along on kind of what the volunteer driver programs mean to those that use it in the rural areas, especially. You know, most of the programs that are out there exist because there is no other public transportation or other private transportation options. And so to be able to create that access across the state, that is why volunteer drivers are so important across the state of Minnesota. Many of our volunteer drivers are driving anywhere from 30 to 60 or even further one way just to pick up their passengers to get to their medical appointments, cancer treatments, get some groceries, those types of things. And so creating that access across the state has been a very top priority in transportation for many years. And so the volunteer driver programs are a piece of that puzzle and that network to provide that. And so that's why we've been trying to hang on to these drivers for as long as we possibly can. Some of the data that was shared earlier by Dawn, if you kind of think about how many hours are put out there, how many miles are put into place to just cover that. If we were to have to create a new system to cover this, think of how many thousands and millions of dollars that would have to go into our system to create a backup system for that. So that is why I have worked many years on trying to create and keep these volunteer drivers viable in our systems here. So I'm appreciative to be involved in so many of the different pieces that are working on this as well. Tom mentioned that I should just talk a little bit about some of the volunteer driver programs and how the effects of COVID have happened and some of the creative and unique ways that we've been working with our volunteers and using them. But pre-COVID, just our 3 counties, we had about 75 volunteers that served in the 3 counties that I work in. We are up to about 30 right now, so they are coming back, but that's kind of the devastating piece that has happened during COVID. Many of these volunteer drivers are older folks that are doing that. They're in risk areas that that's just not a good idea for them to be providing that service. But we've also had some people that never did quit, and so they just keep going and going, and we were able to provide them with the PPE that they need to feel comfortable providing that service. And our service in particular is kind of split between two different types of service. We operate a senior transportation program, which is funded through our Minnesota River Area Agency on Aging. And the other piece of that is for most of our county and state operated transportation, so medical assistance and Blue Ride, U-Care, Medica, and Prime West type transportation that is going on. And so we did have many volunteers that continued just pushing through it, and we're so proud of them for continuing to do that. And we have had many of them come back, but again, we're really promoting and trying to get folks to be able to do that. So just an offshoot on what we did do during COVID, and we continue to do that right now. We did, when most of the seniors were isolated and not going out to medical appointments or being able to go to get their own groceries, we were able to deliver groceries to them, food shelf items. We still continue to do many of the Meals on Wheels programs within our 3 counties. We also moved to a program called Telephone Reassurance, where we were able to use some of our dispatchers to check in with many of our seniors and isolated adults. And so we are continuing to do that program through the MNRA Area Agency on Aging. And so that was a very good funding change that we were able to do that as well. There also is a new program, what's called a warm line. Most of us have heard of hotlines where people in crisis might call a hotline. This is more of a warm line that isn't such a crisis situation, where many of the people could actually call into our dispatch center and get a live person to chat about some things that they might be needing in the community that aren't able to access and things like that. So we've been involved with that within our 3 counties as well, stemming from a project and an idea out of some CARES Act funding through the Kandiyohi County. So I just wanted to kind of point out some of the things that we've all been involved in, and the momentum is here. And I'm very proud of the fact that between the MIPTA, Minnesota Public Transit Association, and MCOTA with Minnesota Council on Transportation Access, there's so many different initiatives going on, but this push with the coalition and partnerships with the volunteer coalition, the momentum is there. I hope everyone will join and help push us through. We've got some great education going on, and there is movement forward, and I'm so proud of the fact that we're able to keep pushing through this. I know we're going to get some action here. And with all of these folks joining together, I know that we can do that. Something that's happened just recently through MCOTA, we had a change in the last year where Tom Gottfried was named the executive director. The change happened, and it's been very positive to have somebody working full-time on that rather than a group and a board that would meet monthly. I feel like that's a very positive moment that has changed and made things actually move forward. There was a leadership meeting that brought together all of the department heads and talking about some of the legislative agendas and kind of aligning some of those so that we can make some progress here. So I really am very happy with all of the partnership that has gone on there as well. just want to promote the volunteer forums that are coming up. This is very, very unique and very exciting to me because we've been able to do so much with technology. I've been able to take part in this, the Minnesota Public Transit Conference via virtually, and I think it's gone very, very well. And I know that the forum will do the same. It's going to bring a lot of different things. I think we'll be able to spend a lot more time and effort and energy into the forums meeting 1 week or 1 hour per month versus trying to pack it all into one day. And I think we'll all be able to get as much information as possible. So with that, I'm open to any questions or things that I can add to the group.
Thank you, Dawn. Thank you, Tiffany. And as Tiffany said, one of the things that led us to lead on the volunteer driver issue and to work with the coalition members was the fact that we were imagining a world where there were no volunteer drivers. And then there were only two options, although those people may not be served at all, or there'd be a request for state and federal funds to provide the services. The cost of continuing volunteer programs is minimal in any kind of a discussion you have. And so we have two discussions taking place, one at the federal level. Obviously, with the dysfunction at the federal level, change is difficult anyway. Big policy, big funding changes are difficult. And our change has to pass Congress to raise the rate for volunteer mileage reimbursement from 14 cents to allowing the feds raise the rate at the same time they raise the rate for businesses. And so we've had legislation for 3-4 years in a row. It's never been heard. At one time there was a provision in the tax bill 3 years ago that would have raised the rate all the way from 14 cents to 18 cents. So not exactly a solution there. So we haven't eliminated our efforts at the federal level. We continue to work with our congressional members. However, the focus is at the state level. And I want to differentiate between what the MPTA and coalition legislative agenda is and what MnCOTA actually has forwarded to the governor for consideration. So Dawn went through the different provisions we had in our coalition effort, and that includes, first of all, having a definition of a volunteer driver. I've been asked before, why do we need a definition? The reason we need a definition is it seems to be kind of a coincidence or simultaneously with the creation of Uber and Lyft. The insurance companies might have been a little confused about the difference between an Uber driver, a Lyft driver, and a volunteer driver. And part of the reason for that confusion is volunteer drivers are paying taxes on their mileage. And when you get a 1099, that generally indicates you're an employee, or a 990, I'm sorry. So that's one of the issues. The other issue is insurance rates. There are insurance companies, and this isn't consistent across the board, but there are some insurers who raise the rates of their members who have policies simply because they are a volunteer driver. And also because they know that in general, a senior citizen seems to have a higher rate of liability accidents, if you will. They think of our volunteer drivers as higher risk. We've had some good discussions with representatives of the insurance industry. We've shared our statistics with them. And then something they didn't know before was the fact that they go through training, their vehicles are checked. So this isn't your standard senior who keeps their license and there might be a question about whether they should have a license, not at all. We also had the issue Don raised of liability. If this is a system working under local governments have an insurance liability. We just want to make sure our associations and agencies have that same cap on liability. So as we're working on all of these issues, the two issues that MnCOTA described as moving forward is the exact ask we made of them. we made a reduced ask because the issues we're working on have to be supported by the Department of Commerce, who oversees our insurers, the Department of Human Services, MnDOT, the Department of Revenue. And to here, I need to give a shout out to Assistant Commissioner Tim Henkel, because it was through his assistance that we were able to have meetings between the agency, government relations staff, and work on this. And it's difficult sometimes to collaborate with agencies. They are authorized to work on initiatives once they're adopted by the governor, but they're also willing to sit down and talk through issues to help you avoid pitfalls, if you will. But because of the number of agencies, it was difficult for us on our own to get everybody to the table. So that was beginning of the path forward as a coalition, and so that was important. So what MnCOTA did forward on as recommendations were the two pieces that we think were the easiest asks. One is a tax subtraction for volunteer drivers so they can reduce their tax obligation at the state portion. It doesn't help at the federal level, but it does mitigate their state tax implications. And then the other is the volunteer driver definition. I would say some of us don't believe that just changing the volunteer driver definition will necessarily help with the insurance issues, but as with any other big project, you have to start somewhere. It's a first step. And I'm hoping, as our coalition members and agencies are hoping, that this will send a positive message to insurers and will make a difference. If not, we can come back and revisit the rest of our initiatives in future years. So I just wanted to leave you with that little bit of information, and then we're going to go to questions now. And we're waiting for questions. If anybody has a question that you want to put up on the screen, go ahead. I'm going to turn around and see if anybody in the audience has any questions at this point, and I'm not finding any questions. I know you received a lot of detailed information. This presentation will be posted for your review later on. But we do have a few minutes left if there's any questions, or if you'd like to share information on your volunteer driver programs with us.
Sherry, this is Dawn. Could I just add a comment?
Yes, please.
Yeah, I just wanted to say that as I was giving examples of the members, the types of organizations that are members of the Volunteer Driver Coalition, I neglected to add RTCCs. So Karen has been there representing the RTCC. She directs, and we have participation from others. So RTCCs have been an important piece of the coalition machine.
Thank you for that. We still don't have any questions. We'll give this a couple more minutes. I know that there was a lot of detailed information, and want to thank everybody for participating today, both virtually and in person in our audience. We've got a good group that made it to the event. All right, well, we don't have any more questions, so at this point, I'll see if Margaret has anything she wants to close with, and we'll end the conference. Thank you again.
Okay, well, again, we want to thank everybody who participated in the conference, both virtually and in person. I just want to make sure everyone knows that the presentations, we will work very hard to get all of the PowerPoint presentations from all of the sessions posted on the MPTA website, which is mpta-transit.org. We have separate pages for the conference, and we will also have recordings of the actual sessions. So not only will you be able to see the PowerPoints, but if you want to watch some of the actual sessions that you missed, you'll be able to do that as well. I also want to really reiterate that Our sponsor information will be on our website after the conference. So for all of our exhibitors, we've created virtual booths for them, which have a lot of information about their companies. A lot of them have a short video, they have contact information, they have information about their products. So just because the conference is over doesn't mean that those will go away. So please, again, go to the MPTA website and visit those virtual booths, and thank our sponsors and all of the vendors who've been part of this conference. The last thing I just want to mention is, of course, next year's conference. We're always looking for folks to help with the planning of this event. Again, we're anticipating that we will be in Duluth and that it will be a joint conference between the Wisconsin associations and the Minnesota Association, along with the agencies. So we're hoping to have a really big, really fun event in Duluth. It's October 4th to the 6th. So mark your calendars, and hopefully we'll see everybody in Duluth next year. Thank you so much.